Hello, and welcome to my office. My name is Dr. Susan Mara, and I'm a naturopathic doctor here in Seattle, Washington, and I specialize in tick-borne illness and bioidentical hormone replacement. One of the things I'd like to talk to you today about is a pro-hormone called д.ha.에이.и. In other words, DHEA. DHEA is considered a steroid pro-hormone and is formed from cholesterol in the biosynthetic pathways towards the production of estrogen, progesterone, and testosterone. It has several functions in the body. It decreases cholesterol, it decreases fatty deposits, prevents blood clots, increases bone growth, increases immunity, supports the immune system, decreases allergic reactions, and decreases triglycerides. It's a really important pro-hormone, and it seems to be very much affected in patients with chronic illness. In my patients, I see very low DHEA levels, and one of the reasons we see such low DHEA levels is I think it has to do with abnormal hypothalamic pituitary end organ function. In other words, the hypothalamic pituitary axis is it's off, so to speak, and I think that's due to a number of things, some of which include chronic neuroinflammation and chronic release of cortisol and the chronic release of pro-inflammatory cytokines like IL-6 and tumor necrosis factor and IL-1. So we oftentimes see very low DHEA, and this is really important because you have to have adequate amounts of DHEA in order for the body to produce adequate amounts of the steroid hormones such as estrogen, progesterone, testosterone, and in order to function properly, those hormones must be in balance. So DHEA is part of the biochemical pathway in which those steroid hormones are produced. It's easily supplemented, and we usually, it depends obviously on the patient. You can measure it in the blood as DHEA sulfate, and it obviously depends on the patient and how low the DHEA level is, but we usually start with 5 milligrams in women and between 10 and 20 milligrams in men. The reason I like to use DHEA replacement is because it increases muscle strength, increases the quality of life, improves sleep, improves the feeling of well-being. It decreases joint soreness, which is oftentimes very present in my Lyme disease patients. It increases insulin sensitivity and decreases triglycerides. So it has a whole host of functions that are endocrinologically very important in the maintenance of good health. I hope you find this informative today, and I thank you for watching. Have a wonderful day.